With the discovery of this bird flu strain in a human patient, how concerned should we be about the spread of the virus? And what can be done to prevent it? For more perspective, we're joined live by Dr. Myles Druckman. He's the Vice President of Medical Services with International SOS. Dr. Druckman, thanks so much for joining us. You just heard our two reports. What jumps out at you, and what are you taking away from this Lancet report?
Well, thank you very much. I think it really reflects that it's a very fluid situation when you look at influenza viruses. I think the one thing that we know for certain is that it's very unpredictable. And I think we're seeing that we're seeing quite good surveillance. I think the WHO came out and said that this was picked up very quickly. So, but we are seeing more and more viruses coming on the scene. We now have H5N1, which has been around for about a decade. We have H10N8 that's been now a year, and we're seeing that increase. And we now have H10N8. So it means that we need to, as the report said, heighten our surveillance, but at the same time, we need to put this in perspective as well. And that these are not pandemic viruses, and we just need to continue to monitor the situation very closely.
Can I get your thoughts on the speed of onset and death in the patient?
Well, I mean, you're going to see, particularly in early cases, changes, or typically it's 4 to 6 days, or it can be earlier, a little bit later. But with new viruses, we can see a lot of variability there. And it's not until you see a number of cases that you start to see a specific trend. So it's hard to take and to gauge much from, say, 2 cases. You need to typically see quite a few to start to see how the virus is ultimately going to affect people. And also, these viruses mutate and change over time, too. So that's the other moving target as well. So making a judgment on this really is a challenge for the health authorities.
Dr. Druckman, I read earlier today that each season, nearly 111 million workdays are lost in the United States because of the flu. That equals about $7 billion a year in sick days and lost productivity. This year, analysts say it could be much, much worse. I know you're in the state of California, which is seeing a lot of cases of the flu. Yeah. How does that strain in California differ, and why are we seeing so many cases of the flu, not only here in the United States, but in Asia?
Well, I think it's a great question, and it puts things in perspective. The real risk today is seasonal flu. As we see in the U.S., if you recall the old H10N8 from 2009, that is the typical flu we're seeing today. It's now become a regular seasonal flu, and you're much, much more likely to pick up that flu than any of these very novel new viruses. So really, the effort is to get vaccinated. I mean, it's still today, if you haven't had your vaccine, please get it. It's still not too late. We were just on a call today with the CDC in Atlanta, and that was the clear message. And we're also seeing the same H1N1 in the U.S. as we are seeing in China, too. So protect yourself with good hand hygiene, stay away from wet markets, as I think your announcer had said. Really focus on, looking after yourself. If you do become ill, seek medical attention. All the good common sense type work, but vaccination, particularly for the seasonal flu, is key.
Dr. Myles Druckman with some great advice there. Thanks so much for joining us from Los Angeles.